So I've come to learn a lot more about ADHD over the last few months, largely because it turns out I have ADHD, probably, and I've always had ADHD. And one of the things that I've noticed about it is it seems to me like there's a higher number of people that present for therapy who have ADHD, but they don't know it. They don't realize they have ADHD, or they've been diagnosed with it in the past and don't understand how, by choosing not to be treated for it, they're actually allowing these comorbidities to exist. So when we have ADHD, there are a lot of other things that come with it: lack of self esteem, depression, anxiety. All of those things are sort of in that spectrum of what people who have ADHD deal with. And if you're like me and you're older and you've never had that diagnosis, you may never have understood that a lot of what was driving all of those feelings that you were having, all of the self esteem issues that you were having, all of those things that make you anxious, that don't make other people anxious, and things that you feel overwhelming emotions about that don't create that sensation in other people, is not because you're crazy. It's not because you are not right. It's that you have ADHD and all of these other things come along with it. And what I've noticed is a lot of my clients come into therapy for depression or anxiety or self-esteem issues or relationship problems. And it turns out that what's underneath that now, obviously there can be other things as well, but often it seems to me more often people who have ADHD come into therapy for these other issues when it's related to their ADHD. And once they understand that it's the ADHD that has driven a lot of those emotions, a lot of those problems that they've had throughout their lifetime, then it can shift everything. I'm Melody Brooke. I'm a licensed professional counselor. I'm a mom and I'm a grandmom. And I just came off of 5 days with my kids and grandkids, and it was awesome. I have amazing children and amazing grandchildren. I'm a lucky, lucky, lucky mom. And what I've discovered is that being a parent when you are ADHD, it can be a really problematic thing. It can create situations where you lose your temper faster than another parent in the same situation would. And why is that? Well, because um, it's a neurodivergent brain that sets us apart from other people. We have a brain that's divergent from or most other people. And that means we have a brain that works differently. That means we are going to respond to things differently. We may get highly agitated by noises, by things that wouldn't bother other people, by not having a plan, right? That's sometimes ADHD people figure out that the way to manage their ADHD is to have plans, to be really organized, and that's sort of a compensation that we can come up with that helps us. And then with children, of course, things never go according to plan. There is never, we do the best we can, but that can drive an ADHD person's anxiety higher. So it's a more difficult thing sometimes to be a parent if you're ADHD. What I've also seen is that because ADHD people are more easily flooded with emotions, and that they have difficulty regulating. That's part of the spectrum of ADHD. Then often it means they're irritable, and they are they lose it with their kids, and they become aggressive and controlling in an attempt to try to get things back under into their plan. And that means often ADHD parents are not the most wonderfully patient parents. They may adore their children and have a good plan for how to manage their kids, but because they get overstimulated because of the ADHD, they can act out in ways that are not necessarily great for their kids. And so we have to have some compassion for these parents. And I've seen it because ADHD in my age group, of course, was not diagnosed, right? We didn't even know that ADHD existed. So as a result, a lot of us are, my age group, I would even say probably 40 and 45 and older, did not have that ever considered as a diagnosis. And so as a result, they maybe weren't the best parents. For me, my problem was being inattentive, not paying attention to some things that I should have paid attention to, that I recognize now. I always thought it was because of trauma, because trauma and ADHD symptoms, they kind of overlap in a lot of ways. And so knowing that, I can look back and go, oh my gosh, no wonder that was so hard for me. No wonder I was unable to provide some of the things for my kids that I wish I could have been able to do. But I was struggling with something I didn't even know was going on. And so when we can have that kind of empathy for ourselves, it can shift the way we think about maybe the things that we did in our past that we wish we hadn't done. And that is one of the things that ADHD people really suffer with, is beating ourselves up for mistakes that we've made, because we know that maybe it wasn't the rational thing, maybe it wasn't the correct thing to do or way to react to something, and we can just feel terrible. Why did we respond that way? Well, we responded that way because we're not like everybody else. We don't respond to things the way everybody else does. It doesn't mean that we have to feel badly about ourselves. We were born this way. It's like, what is that song? Baby, I Was Born This Way. Love that song, because it really helps me understand and have more compassion for the way that I am. And it happens. It happened just this past week. I was in a situation with my daughter where we were at this play area with this slide that it was spiraled up like 25 feet in the air, and then it had this thing that kids could climb up inside of it to get to that slide to slide down. Well, my almost 3-year-old granddaughter was not really big enough to climb up, and she wanted to play. She tried to play on the trampoline, but that was at the bottom, but that didn't really work out. So my daughter realizes she has to take my 4-year-old grandson to the bathroom, and she tells me, I've got to go. And I don't realize that she didn't take the 3-year-old with her. So what I didn't see was my 3-year-old granddaughter climbing up inside the spiral slide, went all the way to the top, and then my other granddaughter was like, no, go back down the slide. And she wouldn't. And she ended up falling all the way down through the structure. Now, it was safe. There were, little things that kept her from going all the way down quickly. So she would like stop and then drop 2 feet, then drop 2 feet, then drop 2 feet. And so by the end, she was terrified. And I didn't see what had happened until she was halfway down. And I realize now that part of that was me not being able to focus my awareness on the fact that that my 3-year-old granddaughter was still there, still needing my attention, and I didn't know it. So then, of course, afterwards, I'm like, oh my gosh, how could I have done that? And I hated that happened. It terrified her. She was fine, but it was a scary thing for a tiny little girl. And I look back at that and I realize, in the past, and I still struggled with it, not, beating myself up over that. Oh my gosh, how could I have not realized that she was there and that she needed to be attended to? And I take a deep breath and realize, it wasn't just me. My other daughter was there, and my son-in-law was there, and none of us noticed. And so it wasn't just me. But because of my ADHD, I have this tendency to just go, oh my gosh, I should have. Why didn't I? And beat myself up. That is one of the issues with being ADHD, and recognizing that's so. I can start to give myself a little bit more of a break on some things that maybe I've, beat myself up about over the years. That's really helpful. And I think it's really important for those of us who think we may possibly have some ADHD traits, whether it's the inattentive kind or the hyperactive type, but just pay attention. Like if you are highly disorganized, if you are if you struggle with self-esteem, if you struggle with being able to focus on things that are not interesting to you, if you have a history of dyslexia, if you have a history of maybe having some difficulties in school, whether it's for being too hyper or daydreaming, which is what I was always in trouble for, then perhaps you might want to consider looking at getting assessed for that diagnosis. And it could change the way you think about yourself. It could change the way you react to people in your relationships. And it's amazing because a lot of my couples end up being with one of them being untreated for their ADHD. And once you start to get that under control, a lot of the conflicts will go away, because that's the thing that the partner is pissed off about, is these things like forgetting to take out the trash, forgetting to, not noticing that things need to be picked up, not noticing that the child needs attention. Things are like that drive a partner crazy, and they think it's personal. They think it's because their partner doesn't care, and it's not the case. And once you understand that, it can shift a whole dynamic in the relationship, and it's huge. So I can see that there's a couple of people, well, one person left. Hi, Annetta. I don't know who else was here earlier, but thanks for joining. And if you have any thoughts or questions about ADHD, I would be thrilled to answer any thoughts or questions that you might have, and any ideas that you might have. I know a lot of people kind of get stressed out about the idea of taking stimulants, which I can understand, which is the first line of defense against ADHD. But the problem is that people who have ADHD do not respond to stimulants the way other people do. In fact, it tends to calm us down rather than rev us up. If you have ADHD, if you don't have ADHD, yes, it's going to act like a stimulant would for anybody else. It's going to make you lose weight. It's going to make you more anxious. It's going to rev you up. That's not a good thing. So that's why it's so important to get assessed, to make sure that you are addressing the right problem. But if you think you might, I would highly consider seeking some assessments to find out if maybe that's something that could help you. I think there are so many of us older adults who have not even considered that as a possibility. Well, I had considered it, but I had seen that I had so much trauma. I thought that it was all trauma related and not ADHD. And I'm finding out that, okay, a lot of that stuff that I thought was about trauma, it's not so much about trauma, but more about the ADHD. So I am grateful to my daughter who introduced me to it. She said she had always been pretty active, and I think at one point they did think she had ADHD, and I put her on some medication, but she responded badly to it, so I quit and didn't put her back on it again. And now she's finally getting treated, and in that process, she turned to me and said, "Mom, you are so ADHD." So I have since been assessed, and yes, I'm now taking medications, and it's going to take me a while to even out, to get to the place I need to be. But I feel hopeful about it. I feel hopeful about it managing some of the things that have been a problem for me my entire life. And I plan to be around for a few decades more. So I think it's worth it. And if you're thinking that you might want to consider it, it would be worth it, no matter how old you are. So thanks for joining me today. I am so happy to have the opportunity to talk to you about things that are on my mind. I know I've talked about ADHD before, but I think I'm going into a little more depth maybe than I did in the past. And I appreciate your hanging in there. And if you have any topics that you would like for me to talk about in the future, I would love to have some topics suggested. So thanks for joining me, and I will be back here next Tuesday at 4 p.m. Central Time, and I'll see you then. Bye.